Discharge from the hospital. The three choices. Now, let me back up and say, a usual hospital stay is 3 days. So if you have your surgery on Monday, you'll be leaving the hospital on Thursday. The choices for where you go would be home, a subacute rehab, or a medical rehab unit. Now, let me kind of take one of those out of the picture right away. The medical rehab unit is actually designed for people who are much sicker or have a more complex medical condition. Most of the patients who are having elective total knees or total hips done are not going to be candidates for the medical rehab unit. So we've narrowed the two choices to home or subacute rehab. As I said earlier, you have to meet a criteria to go home. You have to meet a criteria to go to subacute rehab. And then how you get to your destination. Obviously, if you're going home, you will go by private car. If you're going to a subacute rehab, you can go by private car or you can go by a wheelchair van. At the present time, the wheelchair vans are not covered by most insurance companies. It's a cost that you have to cover out of your own pocket. The care managers can give you more information as far as exactly what the cost is. Choosing a subacute rehab. We're fortunate in Western New York because we have many very good subacute rehabs. Because Kenmore Mercy is part of the Catholic health system, we would like to see you choose a Catholic health rehab center. But there are many other facilities that are not affiliated directly with Catholic health. The same thing with going home. If you go home, we have Macaulay Seton Home Care, but there are other services out there for those patients who are choosing to go home. You can certainly, if you're thinking about a subacute rehab, call a facility that you're interested in, ask to come out, see the facility, tell them the date you're having your surgery, and tell them you anticipate a 3-day hospital stay. They will at least put your name on a list and increase the chances of you getting a bed at that facility when it's time for you to leave our hospital. If you decide not to do that, our care managers can assist you in selecting a subacute rehab that meets your needs, whether it be in terms of geography or other considerations. Returning home, these are Macaulay Seton Home Care is the Catholic Health System's home care services. There are other Catholic health facilities, the subacute rehab centers, and then we have all the other facilities in the Western New York area. These are the subacute Catholic facilities: Father Baker Manor out in Orchard Park, Macaulay Residence, which is located directly behind Kenmore Mercy Hospital, but we do not directly connect to them. And then St. Francis of Williamsville in Williamsville on Reese Street. And then we have the other facilities that are not affiliated with Catholic Health. Medical rehab unit, we have one located here at Kenmore Mercy Hospital. And once again, this is designed for patients who have significant medical problems. Outpatient facilities. Generally speaking, if a patient has had a total hip and they go home and they receive a few days of home physical therapy, those patients will not need outpatient subacute rehab. It's pretty much knowing the hip precautions, following the exercises. However, your total knee patients need to have pretty lengthy rehab after they've had their surgery, because the recovery time for a total knee is a little bit longer, because you need to get the range of motion to the fullest potential after the surgery. Partners in Rehab, these are other facilities that are affiliated with Catholic Health. There's one in Depew, East Aurora. There's one at Sisters Hospital, there's one at St. Joe's campus, and there's one at West Seneca. I know with the listing of all of these facilities, you're kind of spinning around in your mind what you're going to do, what you're going to choose, where should I call. But I will tell you the care managers really make this significantly easy on you. And that after you've had your surgery, they will answer all of those questions and they will direct you to what services you're eligible for, what services you do not qualify for. So that will shorten the list. And then if you have questions, you can contact me. That is my office phone number, 447-6747. You can also email me at elofaso@chsbuffalo.org. Thank you.